White glove health, thinking differently about healthcare. We've spoken to hundreds and hundreds of employers like you know, and we've heard loud and clear they're struggling to control their healthcare related costs. Even in the best of situations, their trend is 5 to 7% per year, but it's still going up. And when we bucketize the categories of why it's so hard, based on what we've learned, it's number one, employers are reliant on a fee-for-service provider network, which is expensive and full of inefficiencies, and it continues to rise in cost, and employers and benefits consultants really have no control over that. The next thing we hear is individual health apathy. And what do we mean by this? It's hard to motivate people to take care of themselves, especially when you're driving them to use a provider network that's hard to access, expensive, and full of hassles. And lastly, the cost of having people absent from work for medical matters. It negatively impacts businesses when people work less. And the more prevalent the chronic conditions, the more prevalent the serious illnesses, the more likely this occurs. So one of the questions we'd like to ask organizations like yours is, would it be valuable to you or helpful if you could provide to your employees and dependents higher quality medical care that's capped in cost and costs less? Would it be valuable to you to provide to your employees and dependents easy access to an enjoyable healthcare experience? Would it be valuable to you to have healthier employees and dependents? And lastly, would it be valuable to you to eliminate many of the ancillary services that you're spending money on today to really limit the utilization of your health plan? If any of those resonate with you, I think you'll find the next couple of slides quite interesting. So what we've learned again in all of the discussions we've had with folks is they're really building moats or walls around their expensive provider network. So this comes in the form of wellness events and programs, biometrics, case and disease management, on-site clinics, and a variety of other things. But in the end, it's all meant to limit the use of this variable cost, uncontrolled, expensive provider network. And so organizations are spending lots of dollars today really guarding the use of their provider network. And in the end, this is simply just a band-aid. It doesn't solve the real problem. And so when you take all of the expenses that organizations spend per person and tally it up, it's significant. And so if you look at the cost of one acute care visit today that hits your health plan, that may range from $135 with meds to for a primary care visit all the way up to $900 and some odd dollars, including meds if your folks went to the emergency room for primary care need. In addition, the cost per person of biometrics, the cost per person for wellness initiatives, the cost per person for half a day of absenteeism, and the cost to the business per person for on-site clinics. When you take all these expenses and you add them up, it can be hundreds and hundreds and hundreds of dollars to thousands. What I think you'll see in the next slide or so is that we can offer you all of this for a fraction of what you're spending today. So let's take a look at our comprehensive offering. Today, WhiteGlove is providing acute care, preventative care, and chronic care. We have a single comprehensive view of the patient. We've built very advanced technology that allows us to really integrate all forms of information into one and make it available to our providers across all of our geographies. We're available 365 days a year, again, across geographies and providers. We have a very comprehensive approach to care, including coordination with other care providers. And lastly, we focus greatly on providing a high-quality healthcare experience. So let me dive just a little bit deeper into each of these areas. When we talk about acute care, we're talking about same-day medical care at home or work 365 days a year, and also over the phone. RX meds and diagnostics, well kits with incidentals, a comprehensive scope of care, and systematized approach to delivering care with regimented follow-up and many other things. On the preventative side, it's a full complement of corporate wellness and programs, monthly biometric reports, health coaching, and proactive management of your team's health. And then lastly, on the chronic side, again, highly technology enabled, working hand in glove with our clinical resources, proactive monitoring of your folks' health and looking for abnormalities, and then interjecting the right clinical resources at the right time, providing initial and sustaining therapies, and again, all kinds of systematic approaches to follow up, scheduling diagnostics, medication delivery, etc. And here's what's so game-changing about what we're doing. Not only is it a comprehensive approach, but we're delivering to employers all the acute care and preventative care their employees and dependents can consume in a year. So that's a full complement of medical care coming to them and all their generic prescription meds. No other expenses hitting your health plan for our care or our meds at $300 per person per year. And if you want to engage with us to manage your folks' chronic conditions, it's an additional $420 to $780 per person per year. Again, these are capped costs to you. It's a full complement of care and meds, no additional cost. And here's the kicker. Your employees and dependents only pay a $35 visit fee. That's all inclusive of their meds, their incidentals, and the care coming to them. And we're so confident that you'll be delighted, as well as your employees and dependents, that we're going to guarantee your satisfaction. And if you're not happy with us, you can turn us off at any time. So why is this such a great benefit that folks rant and rave about? Is because we're bringing to your employees and dependents care, not the other way around. And that's what we're about. Again, focusing on a great experience. So every day of the year, your employees and dependents have access to acute care, chronic care, and wellness, whether they're at home, whether they're at work, whether they're in a hotel room. It's same-day service. It's a full complement of medical services, generic prescription meds, diagnostics follow-up, and all the information that they need at their fingertips via iPhones, iPads, and the web. If they, our care takes on two forms, if you will, or is delivered in two ways. In person, people arrive at your doorstep and they're nurse practitioners, and over the phone with board-certified physicians. And if you contact us for what we call a get well visit, again, all the incidentals are brought to your folks for that flat $35. So things like crackers and chicken soup and Gatorade and ginger ale and just a variety of other things that we often run to the store for. In the end, the reason why we're able to deliver this kind of value to organizations like yours at the price point is because of really our ability to step back in 2006 when we launched this business and think differently about healthcare and bring a game-changing approach to the industry. So first and foremost, we've built a ton of technology. It's a proprietary platform that links together everybody, but ultimately what it does is it eliminates overhead and cost and people. The next thing we've done is we've divorced ourselves from fee-for-service, and so we're not spending 40 cents on every dollar processing claims, and we can generate equal or more revenue with less clinical resource. We use mid-level providers to deliver care in person, so we're spending about a third of what you would on a physician, and nurse practitioners within our scope of care can do everything a doctor can do, except for prescribe certain narcotics. And lastly, we have no brick and mortar. We're turning your conference rooms and living rooms into our treatment center. And so in the end, we've been able to reduce the traditional 5-to-1 support/admin ratio that you see in your current expensive provider network down to 0.5-to-1. And what we're then doing is just passing all that savings on to you. In the end, we're driving down cost. We're improving your employees' and dependents' health. We're lowering absenteeism or improving productivity. And we're giving you a differentiated, terrific benefit that your folks will rant and rave about. And this is all at no risk to you. Thank you for your time.